Do you have sciatic leg pain that's just shooting down your leg, trying to find relief from that? Well, there's a couple simple things that might help you out. When you have sciatic nerve pain, it can come from a couple different areas, and we need to make sure we figure out where it's coming from and how we can best treat that. But one of the areas I want to cover today with you is if you have sciatic pain and you have a herniated disc or a bulging disc, that disc, kind of like what this little red spot here is, could be pushing in to one of your nerves. And if it's pushing into one of your nerves, that's going to cause the pain shooting down your legs. And so there's some simple things you can do. When you have that disc herniation, if you tend to sit and kind of slouch, what happens with that is you're slouching, it opens up, it rounds the back, allowing this space back here to kind of open up and allows that disc to push back towards that nerve. And so a lot of people, when they start to get this pain, will think, oh, I got to stretch. And that might give you temporary relief, but shortly later, you're going to start to feel the pain again. And eventually, that's just going to make it worse and worse and worse. And so we want to make sure you get things going in the right direction. And one of the simple things you can do is what's called a cobra. And so we showed you how that space opens up when you're laying face down on the ground and kind of push up into a little bit of extension in the back. That then takes that disc and pushes it back the way it should go, back forward, taking that pressure off the nerve. And so what you want to do is slowly just work up and down to try and work that nerve or that disc back off the nerve. Here in our office, we use something called spinal decompression. And that's something that's been very effective for people that have some of these disc issues. And so what we do is we lay somebody down here on the table, and then we're going to strap them in the table, and then it uses a computer to help mechanically pull on the spine. And so this part of the table starts to pull down, and that starts to separate those discs, allowing that disc to kind of be sucked back up into the center, pulling it off that nerve, relieving that pain. And this has been shown to be very effective, reducing up to 90% of pain on people as they are dealing with this pain. And so if you have questions or want to see how you could possibly benefit from spinal decompression, give us a call or text us PAIN and we'll give you the answers that you need.